Yes, cancer treatment, I'm sure all of us are all afraid of it once the word cancer comes. And I don't think so we are much afraid of surgery and radiation. But what we are afraid of is chemotherapy. Chemotherapy is everybody will not like to go to the hospital, not meet the doctor. Once you use the word chemotherapy, everybody is afraid of it. Yes, today I'm Dr. Anita Ramesh. I'm a senior consultant in medical oncology at the Apollo Specialty Hospitals in Chennai. I'm here to tell you, don't be afraid of chemotherapy. Chemotherapy saves your lives. So, what is chemotherapy? These are few cancer drugs which helps you to kill the cancer cells in the body, and these drugs can be taken orally, it can be injected in the muscle, it can be injected in the vein, it can be inhaled, it can be pushed into your lungs, it can be pushed into your abdomen, it can be pushed into the spinal cord. So, different ways we are giving these drugs. They are cytotoxic drugs. As they go into the body, they will kill the cancer cells. So, they all die. Now, what happened? These chemo drugs are not targeted. They will hit the cancer cells, they will also hit the normal cells. So, that's why next question every patient asks, what is the side effects will I get? Yes, you will get side effects. All the rapidly growing tissues in the body is affected. One is hair. You will loss of hair for most of the drugs will happen. You will get ulcer in the mouth, the throat, the entire GI tract coming up to the anus. You will have diarrhea, loose motion, you will have vomiting, difficulty in deglutition, you have oral ulcers because of the mucositis. Your bone marrow will be suppressed because again that is a very fast growing tissue. So, hemoglobin falls, you feel tired, your WBC falls, you have chance of getting infection. That's why we tell you to be very careful for the first 14 days. Then what happens? Your platelet falls, so you may have a bleeding tendency. So, these are all rapidly growing tissue. Apart from this, yes, some late tissue effects will also take place, sometime late toxicity. Like these are the first growing. So, let me just tell you, next question everybody asks, when will it happen? Yes, some patients do have vomiting and tiredness immediately when the chemotherapy is given, and some patients do have it when it is usually it occurs in the second week. So, day 1 to day 14 is your day for the problem. It usually sets once you finish the chemotherapy and you go home, and in the second week is the maximum amount of side effects that you get. And after the 14th day is over, you're out of danger. Slowly the counts pick up, all the recoveries take place, your marrow recovers, your mucositis recover, you feel good. Yes, people will ask, when do you want my hair can come back? Yes, but hair will only come back when all your chemo cycles are over, which may be 6 cycles to 8 cycles. Then people do ask, when will can I travel? Okay, maybe after 2 weeks before the next cycle of chemo, because chances of infection are much lesser. There is also a few questions, how do I walk through my chemotherapy? Yes, once you are diagnosed with cancer, we have a histopathology, we do the staging, we have a multi-speciality doctors meet, whether you will need surgery or chemo or radiation or other treatment. Now, once we have decided this particular patient needs chemotherapy, yes, we give you a date, we do the pre-chemo, all the investigations, so we see your heart is good, lungs are good, kidney is functioning well, your blood count is good, you are good, and then only we start the chemotherapy. It's usually 1 day or 2 days, it's a daycare admission or a single night admission. It is given mostly 80% of the time through intravenous bottles, okay, and then you get discharged, and most of the chemos, the review is after a 3-weekly time, that is after 21 days you come back. We do also tell, we have chemotherapy nurses who are trained to administer this, so nothing to worry. We give our personal numbers and the chemo nurses and the hospital nurses. Yes, side effects will develop like vomiting, nausea, bleeding, infection, fever, and we give clear instructions in your pages that don't delay, rush to the hospital. If you come early, you will be back in 24 to 48 hours. You are done, good. But if you come delay, there will be issues of for us also, for you also to cope up with the side effects. So Next, many people ask, do something which does not have side effect? Yes, there are higher molecules, targeted drugs, minimum side effects. But what I like to tell my patients, more the side effects, more is the cure rate. Because how hard the drug is hitting the normal cells, equally hard the drug is hitting the cancer cells as well. So, your chance of survival is higher. Many people ask, why are you giving me so many cycles of chemotherapy? Yes, 6 to 8 cycles minimum, because the cancer cells tend to regrow. Some of them will be sleeping in the G0. They wake up and they start multiplying. So we can't give 2-3 cycles and stop. So we have to complete the 6 to 8 cycles. Some tumors needs longer courses, maintenance. Children with cancer and leukemia needs 2 years treatment to kill completely each and every cell which is below the normal level. So that's the concept of giving the chemotherapy. The chemotherapy is administered after admission. It is covered by insurance, all types of insurance. It is covered in the government hospital, is free, and you should not say that I cannot afford. Yes, it is affordable, it can be given, drugs are manufactured in India, so don't feel afraid, don't be worried, and we have standard guidelines. Now, what drugs will be given? Many people ask, they go from shopping from one hospital to the hospital to find out. But one thing I can tell you, all regimes, standard regimes of first line is under guidelines. Okay, and they are fixed, nobody can change. Anywhere you go, the treatment will be the same, and here at Apollo hospitals we strictly follow the guidelines for the proper treatment, so that there is no mistakes and that the patient care is optimum, and we give the best, so that there is no compromise, because your life matters to us and you have to live, then only we can be happy. Yes, a cancer survivor is with us. Yes, few points. Some people will say, does the chemo affect my heart? Yes, it does. Few drugs, adriamycin. So, will it affect my lungs? Yes, few drugs, bleomycin, for which we are very careful. We will do your heart-lung testing before we start. Do my kidney will be affected? Yes, few drugs like platinum do high-dose cyclophosphamide, it affects the kidney. So yes, they do affect, but then we will be taking care. My color will be dark. Yes, it is, but it will come back once the chemo is over. When will my hair come back? Yes, once the chemo is over, hair will come back. What about my sexual things? Yes, during chemotherapy, we allow you to have sexual intercourse, single partner, use barrier method. Don't conceive. We don't want you to conceive. Sexual, it is not an infectious disease. Yes, you can stay with your family, children, and that's something very commonly people ask. Can my child come to me? Can I be in the same house? So remember, we don't want infection. So anybody infected, any bad environment, avoid. But yes, you can all stay together, eat together, stay in the same room, sleep with your husband, play with your children. Remember, cancer is not infectious. Many people ask that, will it run in families? My wife has got, what happened to my children? Yes, out of five cancers, if in 100 cancer patients, 5 is hereditary. Like breast, ovary, eye cancer in children, colon, few, that's all, nothing more. So 5% chance is there. Yes, there are guidelines for screening and following up patients with family history of cancer. That's all I could know now to tell you. We are open here, we are at Apollo Specialty. Please feel free to call us anytime for any queries, any doubt, and we will guide you through. And please come over here for treatment, because we are one of the specialized hospitals. Thank you.